Hi, I'm Dr. Scott Meier. I'm the author of Incorporating Progress Monitoring and Outcome Assessment into Counseling and Psychotherapy. And I want to do a brief overview and introduction to the book. I think this is a very exciting time for therapists in that there is now a research literature on using data from change-sensitive tests to provide feedback to clinicians about whether their clients are changing or not. And this is a very difficult question for most therapists, is how do you know if your clients are improving? A lot of the research suggests that clinicians may be not the best judges of that, as evidenced by the fact that a lot of clients, if they drop out, often do so during the first couple sessions. But now there is a research literature based on a lot of research by Michael Lambert and Scott Miller and others that have done a very nice job of laying the foundation for providing a basis for clinical feedback in psychotherapy. And so I think these are exciting times. I think we're going to see a lot more use of progress monitoring and outcome assessment for a number of reasons. In the U.S., Obamacare has been successfully implemented, started. While it's not clear exactly how it's going to shape up over the next couple of years, there's clearly an increased emphasis on accountability. And so I think therapists are going to increasingly be asked to show evidence that their work with clients is effective. In addition, the effectiveness question is going to become more important because there's kind of more and more realization that there's a relatively high treatment failure rate in counseling and psychotherapy. And that partially depends on how you've defined treatment failure, but the two components seem to be clients who do not improve over time and clients who actually deteriorate. And if you combine both of those categories, for a typical therapist, probably 50% or more of their clients either fail to improve or get worse, with fortunately the get worse percentage being 5 to 10% on average. But again, there's clearly a need for some information, some data to help clinicians make more informed decisions about whether their clients are making progress or not and whether they should change or adapt the therapy that they're providing. I call this whole approach feedback-enhanced therapies. I think there's also terms like patient-centered therapy, feedback-informed therapy, but the whole idea is a relatively simple one, and that is, as the client participates in therapy, there is some method for gathering data about whether they are showing change, stability, or worsening on one or more indices thought to reflect psychotherapy progress. And this process of gathering data is becoming more and more feasible and easier for the clinician and client. In particular, the accessibility of electronic medical records, the accessibility of tablets and laptop computers makes it easier for clients to provide data, for clinicians to provide data, and for clinicians to see the results of those data collection and analysis over time. But in general, I think there's a push for accountability, and part of that push is to give clinicians useful information about how to know if their therapy is working with any particular client.